Winston, how do you do? I'm going to be doing your physical today, okay?
I'm nervous.
Oh, well, I'm sure I won't find anything wrong. Okay, now, your head is normal cephalic. And what I'd like you to do is let me know if you have any tenderness.
No tenderness.
Okay, terrific. Okay, now I'd like you to smile for me. So cranial nerve 7 is intact, facial symmetry present. Now, I'd like you to clench your jaw and move it back and forth and open like this. So the TMJ is intact, the bilateral masseter strength is present, and range of motion is present, and there's no crepitus. So cranial nerve 5 motor's intact. Now, I am just going to scatter some stimuli. Now, this is sharp, okay? And this is soft. And I'd like you to close your eyes and tell me what you feel, all right? And where?
Sharp on the
Should we do that again?
sharp on the upper right eye.
Okay, very good. And here?
Soft on the left cheek.
Nice.
Sharp on the left upper eye. Soft on the right jaw.
So he's able to differentiate between sharp and soft or dull. And his sensation is intact over the 3 divisions of cranial nerve number 5. Ophthalmic, maxillary, and mandibular. Very nice. Now, I'm going back, and a lot of people might get nervous about now. Just reorient, and what's the first thing you see? Now, this is called the Jaeger chart. Now, what I'd like you to do is to hold this out at about 15 degrees. Now, you can keep your glasses on, but I'd like you to cover up the left eye. Okay, now, can you read this line right here? One there, right there.
6, 3, 9, 2, 5.
Excellent. Now I'm going to ask you to read this line right here.
And the bottom.
Right here.
Okay. 9, 3, 7, 8, 2, 6.
Good. Now can you read this last line?
Yeah. Okay. 4, 2, 8, 7, 3. I think 9 on the last one.
Okay, so that's 20/20 vision at 14 inches. Good job. So that's how to use the Jaeger chart, but it's with corrective lenses. Now, I'm going to set this here. Well, that's fine. Now, I'm going to describe the external eye. The eyebrows are symmetrically distributed. There's no ectropion or entropion. Now, the sclera is white. Now, do you mind removing your glasses because I have to check your palpebral conjunctiva, look up. It's pinkish red, and then the bulbar conjunctiva, of course, is white. There's no injection. Now, this gentleman has brown irises. Now, let me double check the cornea. Now, look straight ahead, please. Now, the cornea is clear. Yes? Okay, good. The cornea is clear. What was he doing? Okay, the cornea is clear. And the corneal light reflex for me is actually at 10 o'clock, and it's bilateral. Could you do me a favor and cover up your left eye? Good. Now, look over here at my finger. Good. Now, remove the left hand quickly. So there is no movement of the left eye. So there's no phoria, and there's no strabismus. No phoria, no tropia. Terrific. Now I'm just going to check how your pupils constrict, so you can look off here. Now he has bilateral equal constriction, and the consensual reflex is actually intact. So his eyes are, pupils are equal, round, and reactive to light. Now I'm going to actually check our confrontation. Okay, now I'd like you to cover up your left eye. Now I'd like you to look straight in this eye and let me know when you see my fingers.
Yes.
Okay, that's 50,
Yes.
90,
Yes.
60,
Yes.
70. So visual fields by confrontation are normal, 50, 60, 70, and 90. Now, if you can just follow my finger and we'll go through the cardinal gazes. Now, follow the finger. That's it. Okay, so those are the 6. Now, look over here. The pupils are large. Now I see the pupils converging. Those pupils are getting smaller. So actually, the 3 cranial nerves, 3, 4, and 6 are intact. Convergence and accommodation are also intact. Pretty neat.